Headache, one of the most common symptoms we experience. But did you know there are over 200 types of headaches, each with a different cause? Let's understand them, simply according to medical classification. According to the International Classification of Headache Disorders, headaches are broadly divided into two types, primary and secondary. In primary headaches, the headache itself is the disease. The most common types are migraine, tension type, and cluster headache. Migraine is usually one-sided. Throbbing, moderate to severe, lasts 72 hours and is associated with nausea, vomiting, and sensitivity to light or sound. It may have aura, visual or sensory warning signs before the attack. Tension-type headache. This is the most common type, mild to moderate, band-like pressure around the head, often from stress, eye strain, or poor posture. Cluster headache is severe, strictly one-sided, around one eye with tearing, nasal congestion, and restlessness. It occurs in clusters, several attacks for weeks or months. Now that we've covered the primary types of headache, let's move to the next category, secondary headaches, where the pain isn't the main disease, but a sign of something deeper. In secondary headaches, the pain occurs due to another underlying condition. These causes can include infections like sinusitis or meningitis, vascular causes like hypertension or aneurysm, head injury, substance use or withdrawal, and space-occupying lesions, such as tumors or abscesses. In these cases, treating the root cause automatically relieves the headache. When headache is due to infection, such as sinusitis or meningitis, it's often accompanied by fever, nasal discharge, or neck stiffness. If it's vascular, from high blood pressure or aneurysm, the pain may be sudden, severe, and throbbing, sometimes requiring emergency treatment. In head injury, the headache follows trauma and may come with dizziness or vomiting. Substance-related headaches occur due to medication overuse, caffeine withdrawal, or alcohol. The pain is dull and persistent, and when there's a tumor or mass inside the skull, the headache becomes progressive, worse in the morning, and often associated with vomiting or blurred vision. That's why, before labeling it as a simple migraine, it's vital to rule out these secondary causes. Now, let's talk about general management of headaches. The first step is always to identify the cause. For mild headaches, simple lifestyle corrections can make a big difference. Get enough rest and proper sleep. Stay hydrated. Avoid skipping meals. Limit screen time and manage stress. For tension-type headaches, relaxation techniques, stretching, and posture correction help. For migraines, maintaining a headache diary and identifying triggers like fasting, certain foods, or hormonal changes can prevent future attacks. And if the headache is sudden, severe, or associated with neurological symptoms like weakness or confusion, seek immediate medical help. In homeopathy, the approach is individualized. The remedy is selected not only for the pain, but for the entire person, mind, body, and modalities. Here are some common remedies used based on indications. Belladonna, sudden, throbbing headache with redness and heat, worsened by light or noise. Gloninum, bursting, congestive headache from sun or heat exposure. Natrum muriaticum, migraine from grief or stress, worse from sunlight. Sanguinaria canadensis, right-sided migraine starting from the neck and spreading to the right eye. Kali bichromicum, frontal sinus headache with thick, sticky, yellow discharge. Gelsemium, dull, heavy headache with weakness, from mental exertion or anticipation. Each medicine is prescribed according to the patient's complete symptom picture. So that's how we understand headaches, by finding whether it's primary or secondary. Follow at Shilpa Dias for more homeopathy videos.